Let's get started. Welcome everybody, and thank you for coming along today to what is the first webinar in what hopefully will be a long-lasting series organised by what we're calling the Australasian Justice Health Network, which sounds very grand, but is in practice just a like-minded group of people like ourselves who have an interest in the health of people who have contact with the criminal justice system. So for those of you who may not know me, my name's Stuart. I'm the head of the Justice Health Group, now based at Curtin University, but also Murdoch Children's Research Institute and University of Melbourne. And so we're currently organising this webinar series, but it's certainly not, this network is certainly more than just us. It's all of us. And so the convening of this webinar series may transition to another group within the network next year or at some point in the future. So just very quickly before I introduce our speaker for today about this network, I've known many of you, and I've worked in this area for more than 2 decades, and there's a surprising number of people who do have an interest in this area as researchers, policymakers, clinicians, advocates, or in some other way. But in my experience, we don't all necessarily know each other or know what each other are doing. So the idea of this network is to try to build those connections, the view being that we can learn from each other and hopefully be stronger, more impactful and effective if we work together. We are building a mailing list, which we won't spam you with, but which we're going to use, at least for now, exclusively for the purposes of letting people know about upcoming monthly webinars. If you'd like to be on that emailing list, please email Claire Chiminello, who will put her email address in the chat. And we promise not to spam you, but we'll just email you with the details of upcoming webinars as they're organised. We'd love to have you back and potentially have some of you give presentations about your work in the future as well. So the format for today is a presentation, which will be given by Damien Linnane, who I'll introduce in a moment. Damien will speak for about 20-25 minutes, something like that. And then we'll use the rest of that time for discussion, because again, the idea is to collaborate and network. So we really invite you to participate and contribute. Damien will give his presentation and then we'll have a discussion after that. But if you do have any burning questions or comments that you'd like to make, you're welcome to put those in the chat during Damien's presentation, and then we'll get to those afterwards. In the interest of making sure that everybody has an opportunity to contribute, can I ask everyone to please be both respectful and succinct in your comments or questions so that there's time for as many people as possible to contribute. And just so everybody knows, these will be recorded. The idea is to make these webinars available on YouTube after the event, and we'll send you a link to that if we have your email address, so the people who weren't able to make it today can still access the content. So look, with no further ado, it's a pleasure now to hand over to Damien to be our first speaker. Damien is completing a PhD through the University of Newcastle, and it's focusing on the lack of mental health care in prisons. His research is based on his lived experience, and he also works as the editor of Paper Chained, which is an art and writing magazine for incarcerated people, and he's a published novelist and illustrator. And it's my real pleasure, having got to know Damien over the last couple of years, to introduce him as our speaker. Damien, over to you.
Thanks a lot, Stuart. Yeah, so I think I might get straight into it with sharing the presentation. So here we go. Just checking it worked before, but can everyone see that now? Slideshow, okay. So yes, so yeah, my story, I guess, is going to focus my journey from prison to PhD. So to start, I guess we'll start from the beginning. So in 2015, I'm working for the military as a combat medic when, and this is very oversimplified, somebody very close to me was sexually assaulted, and I've taken the law into my own house into my own hands by setting fire to his house, and that'll get you in a little bit of trouble. I got a 2-year sentence with a non-parole period of 10 months. And so I'd never had any interaction with the criminal justice system before this happening. So when I went into the criminal justice, into the prison system, this was a whole new world. And I had 3 mandatory appointments. My first appointment is what's called the SAPO, the Services and Programs Officer. And she told me that because I was assessed as a low to medium risk of reoffending, not only did I not have to complete any rehabilitation, I wasn't eligible for any, even if I wanted to do any. At this point, I complained and I said, well, isn't that counterproductive? And she said, Damien, you don't want to do the rehabilitation courses anyway. They're 20-hour tick and flick courses that only exist so we can inflate the number of people that, we said we passed through rehabilitation. My second appointment was with the educational officer, and that basically I was told I couldn't study anything. The only thing they really had was basic literacy, which wasn't of much use to me. There seems to be this prevailing opinion in prisons that as soon as people learn how to read, they'll stop committing crimes. And obviously that's it's a lot more complicated than that. But it was my third mandatory appointment which changed my life, and that's why I'm doing a PhD. And that was with the prison psychologist. And I mentioned to her that after I committed the crime, but before I was arrested for it, I'd started to get therapy and that I'd found it very beneficial, and that my outside psychologist had actually written a letter for the court explaining like how much progress I'd made during therapy. And I said to the psychologist, I said, I really think it would be beneficial for me to continue therapy while I'm in prison. And what she said next changed my life. She said, Damien, everyone in prison would benefit from therapy. But there's no funding for that. My job's just to assess whether people are suicidal or dangerous. And something I've found since this is that anytime you bring up mental health in prison to the government says the same thing. They're like, we've got this many psychologists working in prison, and they see this many prisoners a year, which is a half truth. I mean, there are lots of psychologists in prison. They're all employed by corrections to write reports for probation and parole, so that they're not there to help you. They don't provide any therapy. And further, on the outside, you have confidentiality with your psychologist. In prison, there's none of that. So, if you tell a psychologist on the outside that you're struggling with drug addiction or whatnot, they'll probably give you some help. If you tell the psychologist in prison that, they'll make some notes on the clipboard, pass that information onto probation and parole, and that may impact your ability to get parole. So it's the psychologists that they may be very nice people, but it's common knowledge in prison that the prison psychologist is not there to help you. They're there to help parole, and so they're not a safe person. It's not someone you should be honest with, because they won't help you, but what you tell them can be used against you later. So I'm in prison, and I found out that there's nothing constructive for me to do during my entire sentence. There's no therapy, no rehabilitation, no education. I could give a 1-hour talk about each one of these 3 pictures here, but I won't do that. I'll just summarize each one very briefly. So there was nothing to do. So the first thing I did, I spent the first 5 months of my prison sentence writing a novel, and that's the one on the left here, that's Scarred. It's a crime thriller. I will mention one thing: I had to hide it from the correctional officers because it's a crime thriller. It contains violence, and it would have been banned. It would have been contraband for containing violence. So I had to hide the fact that I was doing something constructive with my sentence for the first 5 months. That was picked up by a small independent and published in 2019. After I finished my memoir, I didn't have my novel rather, I didn't have an idea for a second book. So I started teaching myself how to draw sheerly out of boredom. I actually did this using reference images I got in magazines. Like every time there was a makeup ad in a magazine that somebody happened to buy, I'd get really excited because that's the only time I could get a close-up image of someone's face, and that's what I really like. I like drawing like faces. So anyway, long story short, art turned out really well for me, and in 2021, I got a contract to illustrate the book This Is Ear Hustle for Penguin Random House. If you haven't heard of Ear Hustle, strongly recommend checking it out. They were a finalist for the Pulitzer Prize in 2020. It's a podcast. It was actually the first podcast made on the prison system, made it completely inside a prison, and that's made at San Quentin in California. this was all well and good, but that I was making all this art and writing, but it was all just gathering in a box under my bed. There was no way I could share it with anyone. There's a lot of people in prison, they want to express themselves some way, and there's no way to do that. And I kept asking around, I'm like, has there ever been a prison magazine? And turns out there has been many in the past, but it had been so long since there'd been one that nobody in prison could remember there having been one. So again, oversimplified, after I got out, I got involved with one that was starting up. And then in 2021, the previous editor told me she couldn't work on that anymore and asked if I wanted to take it over. I took it over, it kept getting bigger and bigger, and eventually got to the size where I couldn't do it anymore either. So I applied for funding, and thankfully I got that. And so that's my job now. I'm editor of the magazine Paper Chained. It's mostly shares art and writing from people in prison, and we go out quarterly. In New South Wales, we're actually made available digitally on the tablet system they have for prisoners there. So we go out to 10,000 prisoners in New South Wales, or 10,000 prisoners have access to it at least. And then we have a printed mailing list for around the rest of Australia. Several individual prisons print and distribute it to prisoners themselves. Melbourne Assessment Prison is one of them. And Risdon prison in Tasmania, they don't have tablets, but they have a closed computer network for education, and they've made it available on their closed education system as well now. So I've got out. I'm making this prison magazine, and then I'm also doing what I can, and that was so I kept up with the art. And this is a picture from an art exhibition I had here in Newcastle a couple of years ago, where the title was Broken Chains, and the theme was people who made the most of their time in prison. You can't really see very well from that angle, but I've drawn Nelson Mandela, and is one of the images there, and below him is Earlonne Woods, the co-founder of the podcast Ear Hustle. And as a direct result of that art exhibition, Newcastle City Council offered me a contract to make a podcast on the prison system, which was also called Broken Chains. And with that, I interviewed former prisoners about different issues in the system. Everything ranging from the lack of mental health treatment to slavery, essentially. You don't really get paid to work in prison. But I stopped doing that when my PhD started because it was too much work. But after my PhD started, so obviously I'm doing my literature review. And something I felt very passionately about was the lack of Medicare access in prison. And incidentally, I didn't actually find out about the lack of Medicare access until I got out. So 9 months into my 10-month sentence, I wrote a sternly worded letter to the then Minister for Corrections, complaining about, amongst other things, the fact that I couldn't continue my mental health care plan in prison. And his response to that letter was, or to that part of that letter at least, was very terse. He said, the mental health care plan is provided by Medicare. Prisoners are not entitled to Medicare. And I only got that letter about a week after I got out of prison. And that was the first time I found out. I spent the whole prison sentence trying to figure out why healthcare was so dreadful in custody. It wasn't just the mental health treatment, so yeah, that's another thing. Like you criticize the government about healthcare in prison, and they say the same thing, that like prisoners receive free healthcare, which is a half truth. And what that means is if you go up to the nurse's window and ask politely enough, they'll give you a free Band-Aid or some paracetamol. If you need a doctor's appointment, you're in a world of trouble. But that's an issue for another day, I guess. But nobody gives you a welcome to prison brochure with like, here's things you should know, like you've lost your Medicare access. I didn't find out I'd lost mine until after I got out. And so I started doing my literature review, and something that became very apparent early on is that government reports and organizations have been calling for Medicare in prisons since at least 1985. That's the earliest government report. That was actually a report commissioned for the Minister of Prisons in New South Wales. And so the organizations have been constantly calling for this, but while there's overwhelming support, none of the groups have really come together. Like, for example, and nothing against the AMA, it's fantastic. They they've spoken out about this, but like groups like the AMA will release a press statement like, we support Medicare in prisons, and then they go back to the other 100 things they're doing, which is completely understandable. So all these organizations have independently called for Medicare in prisons, but None of them have ever worked together, and essentially nobody's made enough noise for anyone to care. You know, it's improving the rights for people in prison is not about winning issues, so politicians just don't touch it. So one of the first things I did after I realized this was I organized the first ever conference about the need for Medicare in prisons, and that was at the University of Newcastle's Sydney campus last year. And this is a photo from that conference. That this is the lived experience panel where the four of us there have all been in prison and all had a story about how the Medicare restriction impacted us personally. Incidentally, that's my friend Shannon talking, and her story was quite interesting. She basically, her psychologist outside prison essentially wrote a letter saying, you know, Shannon's mental health is so bad at this point, she's not going to survive her prison sentence unless she's able to talk to someone. So because the prison was confronted with that, they actually went out of their way to give her something that nobody else had ever had before, and that was they made time available once a week for her to have a phone call with her psychologist. So they made that exception for her, but something that's interesting to note is that yeah, on the outside, that would have been subsidized through a mental health care plan, but in prison there's no Medicare access, and so you can't get anything that's provided through a Medicare. So that includes PBS. There's a very limited number of medications you can get in prison, telehealth, and also, yeah, she couldn't get access to the mental health care plan. So while the prison went out of their way to make sure she had these phone calls, her family still had to pay like $300 plus per session because she wasn't eligible for Medicare. So obviously, if you don't have a wealthy family on the outside, even if the prison makes like a concession for that, and that was the first time they'd ever done that. You know, if she didn't have a wealthy family, she wouldn't have been able to get any psychological treatment at all. So what I've been doing since then, my first publication about the need for Medicare in prisons, my first academic article came out in May. That was the first. There's been very little written in academia about the Medicare exclusion. There's basically three articles and one letter. The last article was in 2018, so this is the first publication on this in the last 5 years. And something else I'm doing is that I'm trying to lobby the federal health minister. So there's only two ways to get Medicare in prisons. The first one is legislative amendment, which is a pretty tall order. But the federal health minister, Mark Butler, he also has, under the legislation, he has the power to grant an exemption for anyone who doesn't have Medicare access. And but yeah, no federal health minister has ever done this. So I've started an open letter to the federal health minister asking for Medicare to be made available in prisons. Early on, it was decided that this letter would have more impact if, instead of a change.org petition that's open to everyone, we limited signers to relevant academics in the field and you know, board members and CEOs and like, you know, high-ranking staff in relevant organizations. That was mostly something we put together like around the time of the conference. We've been hanging on to it. It's not actually an open letter yet. It's just planning to be one because basically we've been like exploring other avenues before we kind of, you know, for lack of a better word, publicly shame the federal health minister. We're trying to like negotiate a meeting with him and so forth. So, but I think we're getting close to releasing that. So I'll put a link in the chat afterwards if anyone wants to sign their name. That'd be really appreciated. So what am I doing with my PhD now? So you know, something I'm very passionate about, you know, being the editor of Prison Magazine is the history of Prison Magazine. So as I mentioned, there wasn't one available while I was in there. And but then I got out and I'm like, you know, I can't be the first person who's thought this is a good idea. So, and turns out I'm not the first by a long shot, but it's just been a long time. So I've been researching the history of prison magazines, and here's three I've chosen. The one chosen to share, this is the one on the left is the Compendium. That was actually the first prison magazine in Australia that was actually made by the prison system, and that ran from 1912 to 1945. The Compendium was essentially just a censored version of the news. Newspapers were contraband in prison at the time, and the Compendium was actually made redundant in 1945 when the the relevant minister at the time allowed newspapers into prisons for the first time, so that prisoners could read the latest news about the Second World War. So that was that kind of made the compendium redundant. One of the most prolific magazines of like the 70s was Contact. This is the first issue here. And that was made at Parramatta Jail by the Resurgence, which was originally like a debating team, but towards the late 70s, they started getting very political. And eventually they became too critical of the prison system. And in 1981, Corrective Services New South Wales had finally had enough of them and banned the publication, which is a very reoccurring theme in prison literature. This is the most recent nationally distributed prison magazine on the right here. This was Framed. Framed ran from 1989 to 2004. It was nationwide, but what is it like? So most of the prisoners are in New South Wales. So, and in 2002, they ran an article criticising the Minister for Corrective Services at the time, Ron Woodham. Ron Woodham chose to promote someone who was found at the Nagel Royal Commission into New South Wales prisons to have assaulted prisoners on many occasions. Commissioner Woodham decided to promote this man, John Clock, to Assistant Commissioner, and Framed ran an article criticising this and this decision, and as a consequence of that, he banned the magazine. Incidentally, Framed, their producers, Justice Action, took that to the Australian Human Rights Committee, and the committee found that that Corrections New South Wales had violated the human rights of prisoners by banning the only publication that was targeted towards them. But the AHRC, their rulings are non-binding, so the prison system just promptly ignored that. But so this was the last time we had a nationwide prison magazine in Australia. They finally folded in 2004 after their main audience was gutted from them in 2002. And so we didn't have a nationwide prison magazine between 2004 and 2016, when both Paper Chained and another prison magazine called Inside Out started up. So what am I doing with this? So I found a way to combine the two things I'm very passionate about, and that is the lack of mental health and health treatment in prison and prison magazines. So at this stage, I've applied, I've actually finished applying for prison magazines through state and national libraries. I've now obtained, as of this morning, actually, I just got another issue of Contact through the State Library this morning through the Digitisation on Demand project. So as of this morning, I have 526 digitized prison magazines of 60 unique publications between 1912 and today. And so I'm going to be examining them to do a thematic analysis, looking at what healthcare issues prisoners have discussed in prison literature and how they've expressed these healthcare needs. And here's an example on the right here of the exact kind of thing I'm looking for. So this is a piece of writing that was published in a prison magazine by a transgender prisoner in Victoria. And she's talking about something here that that I experienced myself, which was that she asked for therapy in prison and was told, that's not going to happen. You've got to be dreaming. There's zero chance that someone can get therapy in prison. But she's been diagnosed with PTSD now, and even though the prison system accepts that the prison has caused the PTSD, which is very common, by the way, obviously prison not a conducive environment for rehabilitation. So even though the prison system accepts that that her PTSD is caused by prison, she still can't get counselling, but she's been told she desperately needs counselling once she's released. That there's this public perception that people in prison have a lot of free time. And while that's true in a sense, that they're also often given next to nothing constructive to do. So, this person's got like 15 years in prison, during which she could be doing therapy, but there's none available to her. But as soon as she gets out, it's going to be one of her parole conditions that she has to get like really intense therapy, which is going to, seriously add to her stress of, reintegrating back into society. So this is the kind of content I'm looking for. I'm doing this for two reasons. The first reason is no one's ever done it before. In fact, so I've gotten prison magazines from several sources. One is the state and national libraries, and at both the Victorian and the Western Australian national libraries, I went and applied in person for all the prison magazines, and both the librarians said the same thing. They're like, we didn't know we had this in our archives. No one's ever borrowed it before. So, this is a very underutilized resource. But one of the other reasons I'm using it is Justice Health New South Wales, so the organisation that provides healthcare in New South Wales prisons, they actually did a really big survey in 2021 about health needs in prison. And if you look at it's a really great document, but if you look at the report, the limitations section, it notes that the biggest limitation was that due to the inherent nature of the study, like academics were going into prison to interview prisoners, and so they had to be supervised by correctional officers. And so the biggest limitation was that prisoners would have felt influenced about how much they could complain by the fact that correctional officers were present. You know, having been in prison myself, that's absolutely true. There's a lot of politics in prisons. Yeah, every prison has at least one prison guard who will make your life a living hell if they get dirt on you. So you don't want certain guards to know you have certain, you know, health conditions or issues and stuff and so forth. So that's something I'm doing. Something I want to do with this eventually is I want to start up the Australian Prison Newspapers Archive, which is going to be based on the American equivalent, the American Prisons Newspapers Archive. Now, this is a open access archive that's hosted by JSTOR, and they share 7,000 digitized prison magazines. And this is open access, and it's used by academics for many, you know, in many fields, like not just criminology and stuff, but also like literature and art. Creative industries. Yeah, this is freely available in the US and has been used as a source for many academic articles. And I've actually been talking to the University of Sydney, and they're very keen of helping me set up the Australian equivalent. You know, I've literally got the largest collection of prison magazines ever assembled on my hard drive. Yeah, 500. I've finished applying for them. I'm still waiting for them to trickle in. I'm going to have at least 6. It's going to end up at least 600. But yes, I'd like to make these freely available for other researchers once I'm finished. I was going to talk about prison art, but I might skip that a bit because we're probably getting towards time anyway. But yeah, so more information on me, check out the website. The magazine is freely available at paperchained.com. We come out quarterly. If you put your name on our mailing list, we send out 4 emails a year just to remind people when the new issue is being released. Yeah, but we're freely available online, and we encourage people to print and send the magazine to anyone they know in prison themselves. So because of restrictions on what prisons will allow in, we deliberately print the magazine loose leaf, because we with the first couple issues, we actually had it bound properly like a magazine, and we promptly found that got it rejected from almost everywhere. It's actually, prisons have lots of rules that make no sense. If you send someone a magazine, that's contraband. But if you photograph photocopy every page of the magazine and send it in, that's okay. I don't understand how this works. But yes, the publication I've got on Medicare is there. Oh, also, if you want to have a look at my art, yeah, I'm on Instagram at Embers of Retribution. And I'll put the link to the open letter to Mark Butler in the chat. Now, anyone can edit that. So yeah, please just add your name at the bottom, and I'll sort out where it'll go in the list later. But yeah, so just add your name to the bottom, but don't share the link publicly, because yeah, because anyone can edit it. But yes, that kind of brings us to the end there. Stop sharing, and yeah, please ask any questions. I quite enjoy talking about this issue. So yeah, I'm yeah, very open to any questions.
Thanks very much, Damien. That was fantastic. Great to hear a bit more about your background and the other work that you're doing as well. I've put links to both Paper Chained and Broken Chains in the chat already, and I get the links to the Paper Chain magazines. They're terrific. So if you haven't yet subscribed, I'd strongly encourage you to. Thanks, Damien, as well, for keeping to time. It means we've got plenty of time for discussion and questions and comments. So I'd invite anybody who wants to ask a question or make a comment about any of what Damien's covered to please go ahead and unmute yourself. Someone has to be the brave.
Yeah.
Really enjoyed hearing all that. I just wanted to ask whether you've faced censorship yourself with Paper Chained.
Yeah, good question. So We're approved in corrective by Corrective Services New South Wales. So ironically, the organisation that's pretty much banned every publication in the past. And I've actually been informed by other people, like, enjoy it while it lasts, because eventually there'll be a change of management and they'll just ban it. That being said, so the version that goes out on the tablets, I have to send it to Corrective Services for pre-approval. And the last issue, they didn't take issue with anything, but like in the issue before that, it's sometimes you can't pick what they'll censor. I did an interview with a former prisoner, and after I did this interview, I asked her to send me her photo of herself, just include in the article. And she sent me a photo of her. It was just a regular photo, but she happened to have cleavage in the photo, and the Corrective Services asked me to crop the image up above her chest. Which, it's like, oh, well, whatever. I thought that was a bit funny, because I mean, literally this image wouldn't be any more racy than something you'd see in Women's Day. Like, it was, so I thought that was a bit harsh, but they did ask me to censor one issue. So they said they're very happy for prisoners to talk about personal issues, but somebody wrote a more journalist type article about how the parole system was really flawed, which it is. And they said they didn't want, they said they were happy for people to talk about their own issues, but they didn't want the magazine to turn into something like journalism. So you can still read that article on the version online, but the version that goes out on the tablets is slightly different. But as you might know, we have 8 different prison systems in Australia. They all have different rules, and then there's also like different rules within, like some prisons have their own unique rules. So up until recently, we were banned at 2 prisons, one in South Australia, and they gave me the reason that it was anything that connects people in prison with people on the outside is banned. And so technically we have, we advertise a letter writing program run by a group in Victoria. And so they connect people on the inside with people on the outside. And I said, so I wrote back to South Australian Corrections, and I said, oh, well, look, why don't we already kind of censor the magazine for New South Wales slightly. Can I just take that out for the South Australian version? And they said, yeah, thanks for your email. No, we're still not interested, which very much indicated to me that that wasn't the real reason they don't want it in there. South Australia actually has the reputation for banning as much, rehabilitation stuff as possible. We were banned at a prison in Queensland. They didn't give us a reason, but eventually we got that overturned. And the other thing that so even before Corrections in South Australia officially said they wanted nothing to do with us, and they asked, we already had to make a modified version of the magazine to send there anyway, because we have 1 page of paper chain contains a crossword, and prisoners in South Australia are not allowed to have puzzles. Don't ask me why, but yeah, so South Australia, I'd say, has the worst prison system in Australia. They've just got the most bizarre rules. And so we already had to make a version there that complied with their no puzzles rule. But now we don't really, that's the place that where we don't get let in, which is kind of interesting, because so we don't get into South Australia, but Melbourne Assessment Prison, Alexander McConnell's, Risdon make it available on their computer system. So like some prisons have actually reached out to me, like I just get this cold email like, hey, we've just I'm the educational officer at such and such prison, we just found out about at your magazine, can we have permission to make it available on the computer system? And we some go out of their way to make it involved, and then others go out of their way to make sure prisoners can't get it. So basically just South Australia now. Just looking at the question in the chat. Stuart probably could answer this better. Has there been any work done comparing access to mental health services in prisons across Australian jurisdictions? Because yes, we have 8 different prison systems, and in the absence of Medicare, they all do healthcare somewhat differently. Stuart, do you want to answer that at all? Or?
Yeah, thanks, Damien. Indeed, there has, and I've just pasted a link to the paper where we published the findings of that. And it accords very well, Damien, with what you said, that there's often talk about lots of psychologists in prisons, but the work that we did was asking who's there to provide support and therapy, as opposed to write reports for probation and parole and do risk assessments and things of that sort. And it just shows what everybody knows, which is that investment in prison mental health services is woefully inadequate. I think it's really important that prison mental health services in most jurisdictions, excluding Victoria, were very happy to engage in this process because there was a recognition that more investment in prison mental health services would be a good thing. So look, Damien, I wonder if I could just ask a quick question following on from Cameron's comment. I was kind of reflecting on, you know, the different bits of your interests, and a consistent theme seems to be this, perhaps it's more of an observation, the perverse things that prisons do that, you know, I was reflecting on all of the censorship stuff that you're talking about, and in particular the concerns about connections with people in the community, despite the fact that we know that empowering people and supporting connections with community are very positive things in terms of preventing reoffending. So it seems a bit of a perverse thing to do. And then, you know, we also know that poor mental health is a risk factor for reoffending, and then to resist the introduction of additional funding for mental health services in prisons seems a bit perverse as well. So there's this recurring theme I'm kind of noticing about, you know, the systems doing things that don't on the face of it seem to make sense, even given their mandate to focus on offending outcomes and not on health outcomes.
Oh, absolutely. I think like there's so much in the prison system that's counterproductive. Well, first of all, the prison system itself, you know, let's put all the people who might be struggling with, you know, anger issues and mental health in together and see how that works out. You know, so I mean, the whole concept is just bizarre to begin with. But there were definitely a lot of it was just like little things like you know, I had a when I found out I couldn't study in prison, I actually went to the educational officer and said, look, well, I can't study formally, but can I study informally? Like, can you arrange for for my family to post me a textbook on something? And he was like, they were like, oh, look, no, Damien, if you get permission to receive a book, then everyone's going to want permission to receive a book. And, you know, and a friend of mine, I was very limited with the art I could make. I taught myself photorealism with pencil because that's what I had access to. Like a friend of mine put in an inmate request form to get a piece of cardboard because he wanted to make an artwork with cardboard, and that was denied. So I mean, it's just, yes, everything's so restrictive, and like, you know, any that's something that there's like this perception in from the public that like contraband in prison must be like knives and drugs and things, and well, yes, those things exist, but most of the contraband is stuff that's is just stuff you're not allowed to have, like, you know, like certain art supplies and things, like, you know, so there's definitely a lot of like the amount of restrictions they put on you. And then, you know, like, for example, my parole officer, you know, actually like put it as a condition that she wanted me to get therapy, which I had already involved myself in anyway because I wanted it. But so they spent the whole sentence telling me you can't get therapy, and then when you get out, and all of a sudden you've got to jump through hoops for Centrelink and you know, try and find a place to live without a rental history and so forth, and that this is when they get you to do therapy when you you could have used some of the time in prison constructively. So yeah, there's definitely many counterproductive things, I think, in the system.
Damien, I'm seeing two additional comments or questions in the chat, and I might just invite, knowing both of these people, if they'd like to unmute themselves, Sana and then Lindsay.
So first comment is, if you feel free to unmute yourself while I'm reading it, but just in case like what topics are discussed in the magazines you have researched. So looking at healthcare, it's definitely a completely untapped source. I'm the first person. I wrote an article. I wrote 3 articles over issues 6, 7, 8, a paper chain about the history of prison newspapers, because it just absolutely blew me away what was like in some of these libraries, and that no one had ever really borrowed before. And I've also used other resources. I've actually got one copy of a magazine from the library. I saw the editor of that magazine. This is only a couple of weeks ago. I found that editor from 1989 on Facebook. I reached out to him. I said, do you have any copies of your prison magazine? He said, no, but I sent my lawyer copies back in the day. So then I contacted his lawyer, and his lawyer's like, yeah, I've got those in a box somewhere. And then just like last week, a box of these prison magazines from 1989 turned up. So yeah, I've definitely got like a lot of resources that just don't exist anywhere else, because that's the thing, like prison magazines, they were quite ephemeral. A lot of them started up, they were banned. I've actually found a couple of magazines that were banned after the first issue. It's normally the correctional officers that shut it down on the grounds that, prisoners shouldn't have anything nice. Where was I going with that? Yeah, so content in the magazine. So poetry, like there isn't a lot of like kind of journalism stuff. Like, you could have theories as to why, but like poetry seems to be the main way people like to express themselves. But I actually warn people sometimes on the outside. I should have mentioned this earlier that like a lot of the content we get is quite dark. People are in there, they're isolated from their family, they're depressed, and so the poems reflect those kind of themes. But yeah, definitely there's a lot of you do get people like just in general like voicing their complaints about the system. In fact, in the UK there was actually a case where like a prison magazine was explicitly brought in by the prison system basically to help prevent riots, because they found that if prisoners had a constructive outlet to voice how frustrated they were less likely to assault the officers or something. I don't know, but like yeah, so I can definitely see like a big need for things like this. So while I'm grateful that Corrective Services New South Wales has made their magazine available on their tablets so that 10,000 prisoners can read it, I am grateful for that, but at the same time, I really feel like I'm doing them a favor. I'm providing prisoners with a creative, constructive outlet at zero cost to them. But all they have to do is accept it. But in terms of topics, there's definitely a lot of people complain, use it as a way to voice their grievances in there. A lot of poetry. Art's a bit hit and miss because we're hamstrung by what people can send out. So you can do the world's greatest painting in prison, but how are you going to get a photo of it? This is an issue with prison art in general. Like someone will spend 20 years of their sentence making art and get really good at it, and then they get released and they'll go to a gallery like, can you sponsor me? Can I see your portfolio? I'm like, well, I don't have a portfolio. I made all the art. I sold it to people in prison. I couldn't record what I was making. So it's art's a bit hit and miss just because people are unable to send us certain things. And also once sending something out of a prison is hard enough, sending it back in is 10 times more difficult. So like if somebody did a painting, they'd have to apply for permission to post me that painting. This might take, it might take 2 weeks, but it might take 3 months to get approval. Then the painting gets out, and they'll never let it back in because it'd be way too easy for me to like, I don't know, put a dab of LSD in the corner and then post it back to them or whatever. So and so people are hesitant to send us certain things because they know they'll never get it back. But we do see a lot of reoccurring themes of like depression and things in both art and poetry for sure. Ironically, I've kind of got the data collection phase of my PhD like done now. I've applied for everything and I'm waiting for it to come through. I haven't spent as much time reading the magazines as I would have liked to. Like some of these, like I've got 60 different publications, and in some cases I've got 50 issues of like a certain publication, and I've so far read 0 of them because I've spent so much time applying for things and stuff. But there's definitely some reoccurring themes of just people voicing their frustration in the system. Just a couple of days ago, actually, I found an article from 1989 in a prison magazine complaining about the lack of Medicare access. So this is something that prisoners have been voicing their concerns about for quite a while now. Just looking at the next question.
I see there's 4 other questions in there, Damien. So
right.
you've started something now.
Oh yeah, so what use of art in prison and the benefits of people's well-being, rehabilitation. Yeah, so how my day starts. I wake up in the morning and I walk down to my PO box and I collect the art from people in the mail from people in prison. It's really hit and miss. Some days there's 1, other days I'll get 6, and sometimes I don't get any. But like I have gotten many letters from people saying like, well, I can't believe, why hasn't anybody ever done this before? This has made such a huge difference to my sentence. So I get like these like thank you letters all the time from people saying like it's changed their sentence, and they've never seen something they've made in print before, and so it has like incredible benefits on well-being and self-esteem, and that's something that the prison system doesn't seem to understand in general. Is that prison education, the benefits don't come from getting the statement of attainment at the end. The benefits come from the experience of learning. but you try and tell the prison system that they should be improving people's feelings, and obviously they're gonna have a field day with that. They're just gonna laugh you out of the room. But it's it definitely, like education in prison, the benefits come from the experience of learning and the improvements in self-esteem, and that's the same with definitely art and writing and giving people a constructive outlet, because that was the thing. Like I've always been a self-motivated person. That's one of my strengths, at least. But like I kept making art and writing, but it all kept gathering in a box under my bed because there was nothing constructive I could do with it. Like the age of the writing journal like ended a long time ago. There aren't really places that publish, like there's like a Curtin magazine I'm aware of that publishes poetry in general, not just for people in prison anyway. I actually got some material from a guy in Texas, because we're available for free online, and word of mouth. Like sometimes I'll just get like a random letter from a person in Nebraska or somewhere in the UK, and I got a letter from a guy in Texas who said he sent me a poem, and he said, I actually he got life for murder, so he's been in for about 20 years, and he said he had 300, he wrote 300 poems, and then one day he got so frustrated the fact that he was just writing poems and they were all just gathering in a stack that he in an act of depression, he set them all on fire. And so, basically he had nothing, he was making all this stuff and he had nothing constructive to do with them. And, that was frustrating for me for 10 months. So I can kind of completely understand why after 20 years, he was like, well, why bother making poetry if I can't do anything with it? Yeah. So, looking at the next question, I was wondering if you had any thoughts about the role of lived experience peer work in responding to people's mental health needs. Do you think this would be worthwhile? Well, definitely. Also, there's a reason why Alcoholics Anonymous is the world's most, successful rehabilitation program, and that's because it's run by former addicts. If you got rid of those addicts and replaced them with recent well-meaning university graduates, the program would turn to crap overnight. And so there's this feeling in prison that nothing works. We bring in courses and nothing ever works. Well, nothing ever works because you keep doing the same thing over and over again. You keep bringing in like a well-meaning person who has no idea what prison's like, and getting them to run a course. And that's just another thing. We've got 8 different prison systems. Like I've only been allowed to go back into prisons since last November. So in New South Wales, you have to have been released. Your parole had to have been ended for 5 years before they'll let you apply to go back in. In Victoria, it's 1 year. In Western Australia, it's you're banned for life. You can never go back into a prison again if to assist in like a course. Like, I wouldn't be able to, if I'd been in prison in Western Australia, I wouldn't be able to go in and teach art in prison because I'd been to prison. There's definitely a huge role for lived experience, because, I don't want to compare prison to the sacrifice people make when they go to war and stuff, but like when I meet another prisoner, there's kind of like this implicit knowledge, like it's kind of like I assume war veterans feel the same way, like, oh, you know what I've been through, so when I meet another person, like I automatically know the kind of mental health trauma this person has been through, and so it's a lot easier to relate to each other and stuff. But looking here, in an ideal world, what else would mental health support include? Oh, yeah, that's a good question. So, I mean, I suppose there's a lot of things that could encompass. Like there's very little transitional support when you get out of prison as well. So, like, for example, healthcare in prison is very bad, but not only do you lose your Medicare access in there, you probably, if your sentence was very long, your Medicare card probably expired. And then when you get out, you've suddenly realized that, now you have to apply for a new Medicare card from scratch. And, that's probably going to be low on your priorities list because you need to find a place to sleep tonight. And so, yeah, like a transitional, so it wouldn't, as far as I would say, like, mental health support is very important, but it's just the things that would peripherally improve mental health, like helping people find, transition their health services. That's another thing I'll mention is that, my health record provided through Medicare which means that any of the healthcare you do receive in prison doesn't get added to your your My Health record, which means if you go to your doctor outside, or you have to then apply for this information. I applied for my medical records through Justice Health, through Freedom of Information. It took 8 months for them to turn up. So for 8 months, I was without, any evidence of the treatment I did and didn't receive in prison. So yeah, there's just no continuity of care at all. And so I think like those kind of peripheral things would really help mental health support, like things that aren't necessarily mental health itself, it's just things that would alleviate stress. I could probably go on a 10-minute talk about the amount of hoops that Centrelink made me jump through. I'll mention one thing. I was running a business before I went in, like it's a very small business, made a few $1,000s a year. It was just a side hustle. And then when I got out, Centrelink wouldn't give me, they like cut my payment in half because I hadn't provided last year's tax return. I'm like, I was in prison. You've got the records there. So of course I didn't earn any money through my business. And they're like, we still need your tax return to process. So like I had to spend about, weeks gathering the data for that. It's just like, prison is horrible, but it's also easy. All your needs are met, like, all your basic needs are met, being a person who grew up in a very poor household, like things like rent were always a problem. They obviously food and accommodations are paid for, and then you get out in prison system, and not only do you have to do all this yourself, if you've been in for 20 years, you've lost these kind of social skills. But anyway, I'm probably sidetracking myself too much. Look, next question: are there many informal prison magazines located with individual prisons? So yes, it's really difficult to find information on prison magazines because, a lot of them are ephemeral. A lot of them were only made inside the prison. They were never really distributed outside the prison. So all copies of them have been lost now. Of the 60 publications I've got, very few of them are full sets. I'll have volumes 1 to 3, and then volumes 7 to 8, and then volume 12, because nobody hung on to these, nobody donated them very few people donated them to the state libraries. So it's difficult to find out that prison magazines exist. There's only a couple that I'm aware of that are running around the country. One's actually probably the longest running one in Risdon Prison in Tasmania. They've got all their own prison magazine called The Insider, and that's been running I think for about 20 years, possibly longer. But that's the thing, it's only produced internally, given to prisoners in there, that they don't make it available online at all. So, there's actually a group that's trying to start up a prison newspaper at the moment, a nationwide one that goes out weekly. I think that's very ambitious, but they actually reached out to me for feedback. And they said, what do you think about the name The Insider? I'm like, well, that's the name of the longest running prison magazine in Australia. It's in Tasmania, and that they had no idea that existed, and how would they? So it's very difficult to find information on them. I put a call out in my magazine. I'm like, does your prison have a magazine? Let me know. And I've actually received about copies of probably 4 or 5 magazines. There's one in South Australia called the Razor Watch, and but like a prisoner has here's the latest copy of the one at my magazine, and so I've got issue 100 of this magazine just on its own there. But so it's very difficult to find them. And one of the first places I went before I went to the State Library and the National Library, the first place I actually went was Corrections New South Wales Library, and Corrections were the people who work in their library and records department were the first people to say their record, the historical record keeping of Corrections Services New South Wales is, in their own words, dreadful. They kept very poor records of a lot of things. So there could be twice as many prison magazines out there that I just there's no way for me to know that they exist, and B, ones that have existed in the past, they'll be lost to the sands of times because nobody thought to keep or preserve it. What's the best way we can currently assist with developing continuity of care via Medicare access to patients in custody? Good question. I suppose it depends on the state and what the prisons will allow and stuff. I'm not really sure what the single answer to that is. Just thinking the best way to assist with developing continuity of care. In prison, a lot of people don't have a lot of foresight. So like it would be like, I think the least, like literally the least the prison could do would have like an internal review process. So currently 36% of people released from prison either don't have or don't know if they have a Medicare card available to them. So I think the absolute least the prison system could do, and I really mean that, is just make sure that the person reapplies for their Medicare card before they get out. If there was some way we could, you know, lobby prisons to do that, that would, you know, yeah, be at least a start. Yeah, but like I think what I'm trying to do, like it's getting Medicare in prisons is a tall order, B, it's also quite complex. So we're kind of aiming for this low-hanging fruit of trying to get a couple of item numbers in, like for example, Indigenous health assessment, and probably something I'd like to add for that is my health record, so that anything that you receive in prison is then then available to your outside doctor. Because I mean, like it's also, and this shouldn't be the main motivation, but like in as well as being like dreadful, the prisons themselves, like, you know, if you have certain tests done in the prison, you know, it might be quicker to do that test again on the outside than apply for the records from the prison system. In fact, it's almost certainly going to be quicker. So, you know, that puts an additional strain on, like, you know, the public health system and Medicare itself. So, like, why couldn't we just have these records continue over the first place? So I think, yeah, like lobbying to get, you know, like Medicare in there and so forth, so that these records can be made available. Yeah, that's the first thing that comes to mind. So I mean, yeah, putting your name on the open letter, it helps. Yes, just Stuart, do you have any other ideas?
Oh, look at Damien, I think that's a terrific way to end. I see that we have one minute left, but it's been terrific to get so many questions. I feel like we could have spent an entire hour discussing each of those things that was raised. So thank you for trying to kind of address each of them in a couple of minutes each. Particularly, I think that issue that's raised at the end there about continuity of care could certainly be the topic of an entire webinar in future. So we'll take that into account. Look, we do want to try to wrap up on time. Our next webinar is in 4 weeks on Friday, the 11th of August at the same time. The speaker is Professor Mark Stuart from the Burnett Institute, talking about the PATH study, the Prison and Transition Health Study. So please come along. If you haven't yet joined the mailing list, again, just please email Claire Chiminello, whose email address is in the chat, and she'll add you to that list. But just to finish, I want to again thank you very much, Damien, for a fantastic presentation. This was a terrific way to kick off this webinar series. I can see a whole lot of people have really enjoyed it. So please join me in thanking Damien for a fantastic presentation.
Oh, thank you for the opportunity. I do enjoy talking about these issues, because that's the thing. Yeah, not enough people know about it because very few people are willing to talk about it. So, you know, yeah, it's great to be able to share the story, and feel free to reach out if you have any other questions you think of later. Yeah.
Thanks so much, Damien, and we'll hopefully see you all in 4 weeks' time.